Good morning. You are welcome to a health guide. My name is Dr Isa Tosin. We have been discussing travel health and it is not over yet. Today we are looking at DVT. DVT as one of the specific conditions or risk for travelers. What is DVT? It is called deep vein thrombosis. Deep vein thrombosis. Now, this is one of the commonest complications that travelers actually encountered, and so you must get ready to avoid it. So when you travel and you are moving from Lagos to Australia, or you're moving from Lagos direct flight to China, these are very long journey, or sometimes just from Lagos to London 6 hours, or from Lagos to Saudi Arabia 5.5 hours, or wherever you call it, depends on your condition. For example, you have high risk to this disease. If you are obese, you are very fat, you are on a high risk. Number 2, if you have hypertension before you embark on a journey, you are on a risk of this disease. Number 3, you are diabetic, you are at risk of this disease. Number 4, if while you are in the plane, you sat down in a position that is not convenient for you and your leg is dangling or is suspended, you are at risk of DVT. What's DVT? DVT means that when the blood moving around in your body suddenly clotted, just small clot, a little tiny clot like not bigger than the tip of a pen, and that clotted blood begin to move around your body. That particular condition can kill very fast. And so, as a matter of fact, when you find yourself in this condition, if you are having any of those high risk conditions I've mentioned, you must be very careful. Or you've just been operated a week or 2 weeks before and you have embarked on a journey, you are prone to DVT. So what do you need to do? While you are in that plane, beware, you must not sit in a position that's inconvenient for you. Tell the air crew you are not comfortable. Tell the air crew you need to adjust the seat so that will not be a source of your trouble. Number 2, you might need to get up from that seat and move around the aircraft at a point where you can do so when the plane is balanced in the air. You may need to do that, move from your seat to backward and forward so as you're not sedentary on your seat. That also promotes the problem of DVT. Number 3, that's what we call third stockings. Third stockings means that this particular stockings, you're going to wear it onto your leg to compress the muscle so that this clotted blood will not occur or will not be able to move around your body or move to your heart or your brain. If a clotted blood moves to the heart, it causes cardiac arrest. It moves to the brain, it causes sudden death immediately, and that cannot be your portion by God's grace. So you need to be very careful so that this doesn't occur to you. And in case you landed where you're going and then you feel some of these symptoms, that your leg is heavy or you have a particular location of your leg that's swollen or is warm, painful, beware, you already have a DVT. You will present yourself to the nearby hospital and the doctors will assess you and give you appropriate treatment. Otherwise, sometimes you may need to take aspirin if you don't have ulcer when you are embarking on a journey to prevent DVT, or immediately you land, you will take another dose of aspirin to save your life from DVT. Until we come your way again, you can reach us on 08023311868. Thank you for listening.